biggest thing that we do is we've tried to partner with other organizations when it seems appropriate, be that in our local area or even regionally or within New Hampshire. For example, we've been able to bring in some expert care in cardiology, GI, ophthalmology, in outpatient and inpatient settings. We have used telemedicine pretty extensively, including backup for ED, ICU, intensive care nursery, neuro, stroke, psych, mental health, a lot with partnerships through Dartmouth, but some other organizations as well. So kind of finding ways to take advantage of the expertise of your neighbors to provide the care. We've also shared providers across affiliates or neighboring communities. We're not busy enough for a full-time ENT or urologist, but if 1 or 2 days a week they were at another community that was within driving distance, that's a win, because now it's hard enough to recruit a full-time doc, but to recruit a part-time doc, forget it, you just can't do it. And sometimes even within our community, we have people that work both for our small hospital and for the FQHC in town, and that's worked for them. A bunch of telemedicine when reimbursement allowed. Clearly increasing use of APPs over the years, both in primary care, specialty care, behavioral health, and certain medical and surgical specialties, and often over time developing them to a higher level of care than you might expect in terms of expertise. Not right off the bat, but advance them, skill development. It's good professionally for them. Usually they're interested in doing more, learning more, but doing it in a safe and supportive environment. We've also tried to build the bench in selected specialties where we needed to. Some of that's been done with per diem employees, some with what we call PSA or 1099 contractors, where they have a full-time job, but they have their own little side business where they do things. So they, maybe on their week off, if they've got a 3 on, 1 off, or a hospitalist rotation, they'll help. And then the other piece has been with locum agencies, Medicus and others, particularly with trying to get recurring coverage, so not, provider of the week or the month, but somebody who's willing and able to come back, and then kind of becomes part of the team, which is a different approach entirely.